now. You've been hearing on Breakfast all morning about booster jabs for the over 50s, and children between 12 and 15 are going to be offered a dose of the vaccine in England. Dr. Poonam is with us this morning from her surgery in Glasgow. And of course, these measures were in place, Dr. Poonam, to try to help protect us, try to help protect the NHS going into the winter months. One of the things that people are struggling with is getting an appointment to see people like yourselves, GPs. What's your view on this at the moment? Because it's causing a lot of frustration, but we are where we are, aren't we?
Yeah, look, I wholly empathise with people that are perhaps struggling to get face-to-face appointments with their GPs at the moment. Now, I think, like, all I can do is just give my side of the story as a GP on the ground. And I put my hand on my heart when I say that in my 15 years as a doctor, 10 years as a GP, I have never seen it as busy and as relentless as primary care feels at the moment in this last year. And I know all my colleagues across primary care will echo that. And the struggles and the frustrations that you mentioned, these are faced on both sides, from the GPs and from the patients, because demand is just through the roof at the moment. Prior to the pandemic starting, I was reflecting on a typical morning. I would have somewhere between 15 to 18 patients face-to-face. Now, a typical morning, I'm seeing over 40 patient contacts.
Wow.
So over the course of my day, I'm seeing 2.5 times more patients than what I would have done 18 months ago. Okay. And there's lots of reasons for why this is happening. One of the biggest ones is actually the exponentially rising hospital wait times. So I'll give you an example. Last week, I saw a patient who I'd seen just prior to the pandemic, had severe knee pain, really debilitated, sent them for x-rays. It was, showing degenerative changes, arthritis. I'd, got them their pain relief, but I'd reached the end of the line where I can go as a GP. I'd referred them on to orthopedics. They only got seen last month for the first time in clinic. They've been told that they need a knee replacement, but it'll be at least another 2 years before they get that surgery. So, of course, where are these patients meant to go? They come back to their GPs, and that's the right thing to do, but we can only support them in the best way we can.
Yeah.
We've got that. We've got acute care, chronic disease care, non-COVID care. We've got the vaccine rollout. We've got the winter crisis.
Yeah, you can feel your frustrations coming through. Exactly. So maybe we should look at it from the point of view of what we can do as patients then, maybe to help with that process.
Because it sounds like there's a lot of pressure on the staff at the moment. Is it helpful to be clearer with what we're feeling at the moment that we call, like to the reception or something like that?
Yeah, I think there's lots of things actually patients can do, and it's important that they feel empowered, because it does get to me, the frustrations that patients are feeling. So, when you are phoning up, so I tried to sit in reception a couple of weeks ago to do some of my paperwork. I don't know how our frontline staff do what they do. The phones are off the hook. They're trying their best to appoint people and do everything that they can. So often people say, well, why is the receptionist asking me, what's wrong with me? This isn't because they're nosy. It's because they're trying to see how can they best put your appointment in terms of appropriateness. So be clear with them. Tell them what the reason is. This will help them see whether it's a GP that you need, whether it's a practice nurse, the pharmacist, the advanced nurse practitioner. And also, remember, primary care is made up of lots of different experts as well. They're all experts in their own right. So if you're allocated that, do not worry. Have a clear idea. If you have any language barriers, ask for an interpreter. We can certainly do that over the phone as well with 3-way consultations. And I think it's just important just to be as open as you can with the receptionist before you see the doctor.
And is that the same way then when you're actually in the appointment with the doctor, in terms of having a plan, having your questions prepared? Would that help?
Yeah, so we have on average 10 to 12 minutes per patient. So it's a little bit of time, it's not a huge amount. So if you have got more than one problem, it's important to just tell your doctor that at the very beginning. Also, don't leave the most important thing to the very end. So if you've got something like, I don't know, a discoloured toenail, you want a repeat medication, but you're also having chest pain, don't leave that to the end. So if you lay out the list of things at the very beginning, we know we can kind of handle that. If you've got more than one appointment, always ask for a double appointment. The other thing is have a bit of pen and paper and pencil ready before you actually speak to the doctor. Write down what's the kind of main things that you want to speak about. I always say, as doctors, we are trained to think with the acronym ICE: ideas, concerns, expectations. So your doctor will always have that at the back of their mind.
Yeah.
So you have to think about that too. What is it you think might be going on? Maybe you've done your own research and you've got some worries about that. Concerns. You might be speaking about a headache. We'll think maybe it's a simple headache, but you might be worried it's something more sinister.
Yeah.
Let your doctor know what you're worried about.
Okay.
And lastly, expectations. What do you actually want to come out from the appointment? Do you want a blood test, an ECG, an X-ray?
Yeah.
Let your doctor know so the expectations can be met.
It sounds like be prepared as possible, right? Doesn't it?
Exactly.
Sure, yeah. I'm seeing some questions coming in right now. We'll try and catch up with Dr. Poonam before the end of the show today to get your questions to her. Just quickly on the booster jab for over 50s, it's expected. What's the latest? Anything confirmed?
Yes, so later on today, hopefully we should hear about the COVID winter plan that the Prime Minister is going to set out. There has been lots of chat about the booster vaccine giving extra protection, particularly to those that are more vulnerable. So we're thinking that those 6 months on from their second dose, they will be eligible, hopefully, for a booster jab, initially to those over 70 and with vulnerable categories, but might be extended to those over 52. So let's see.
Hopefully we'll chat to you a bit later on in the show. Thank you for now, Dr. Poonam.
Yes, thank you.
That COVID booster jab is all part of the